Hi, my name is Vanessa, and I'm going to be teaching you how to provide oral care for an unconscious resident. So first we want to make sure that we have all the supplies that we need. So we're going to need some hand sanitizer, or you could also wash your hands. We're going to need gloves. If this is your loved one, gloves are optional. And then for the oral care supplies, we're going to need some lip balm. We're going to need swabs, a toothbrush, some mouthwash, some wet mouth moisturizer if you have that as well, and kidney basins and a barrier for all your supplies, and also some towels to cover the patient. So first we're gonna sanitize our hands. Make sure that it dries. Great. So now I'm gonna lower the side rail. And we wanna make sure that our patient is at a 30-degree angle. So I'm gonna slightly raise her up. And then we also want them to be facing towards us because they are unconscious. So I'm gonna gently help her like this. And then my hands are clean. But for this example, I'm gonna wear some gloves. So I'm going to cover the patient's chest, and I'm also going to cover the side where her mouth is open. So on this side, on her right, and then I'm going to pour some mouthwash into the kidney basin. And then I'm going to take my toothbrush, I'm going to open it, and then my swab as well. So first I'm going to take the toothbrush and I'm going to just gently clean her teeth. So you don't want to go far back in her mouth, because that could trigger her gag reflex. So I'm gonna just clean in there, and then just clean the surfaces. Great. This kind of just loosens up all the food that they might have stuck in their teeth. Okay, done. I'm gonna put it here. And then I'm gonna take a swab. You might want multiple swabs. And I'm going to dip it in my mouthwash and I'm going to wring it out. And now I'm just going to pick up all the pieces of food that were loosened up previously. And remember that you don't want to go too far back because that could trigger their gag reflex. And then I'm going to grab more until we pick up all the pieces of food. And then now I'm going to take a dry one and I'm going to just swab one more time. Make sure that it's dry. And then we're going to just make sure that her mouth is dry. And then I'm going to put some lip balm on her. And then we're just going to gently guide her head back to the position it was at. There we go. I'm going to take this away. Get this here with all my garbage. And I'm going to just put her head down to where it was at a comfortable position. And that's about it. So generally when the patient is unconscious, we want to provide oral care about every 2 hours. We just want to make sure that their mouth and their lips don't get dried out. So it's always really important to keep some chapstick and some oral swabs at the bedside and like a cup of water. But make sure to be wringing out the swabs before you actually insert them into the mouth. So just a friendly reminder that if the patient is on oxygen, it's not safe to use petroleum products on the lips or anywhere on the body. So all the products that we have for lip balm with yellow cares are petroleum free.